We are live now.
Okay. Good evening, Enlace. Thank you for joining us. Welcome, everyone. We have a special bonus presentation for you today, but I'm going to get us started off first with our mission and vision of Enlace. Our mission is to develop and strengthen connections through information, collaboration, and partnership with organizations and leaders who serve the Latinx community. And our vision is to enhance social capital within the Latinx community in the Charlotte metro area. So welcome, everyone. Thank you for joining us today. If you haven't already checked us out, you can find our website at enlacecharlotte.org, and you can find out lots of great information about Enlace, about membership, our resource hub, all of the benefits. But for today, we have a special presentation for you today. And I'm going to turn it over to Natalie, who's going to get us started with our, introduce our speaker and get us started. So I'll turn it over to you, Natalie.
Hi, everyone. My name is Natalie Marles. I'm the Outreach Coordinator for the Healthcare Access at Charlotte Center for Legal Advocacy, and also the Outreach Coordinator for the new North Carolina Ombudsman, Medicaid Ombudsman program. As many of you know, Medicaid is changing in North Carolina, and we wanted to do this presentation to give you more information about this and also to present to Enlace the new North Carolina Medicaid Ombudsman program. With me is Julian Taylor. She is one of the managers, program managers for the North Carolina Medicaid Ombudsman for the Region 3. And she will be doing a presentation about the new program and answer any questions that you may have during these presentations. So feel free to put any comments and any questions on the comment side of the Enlace Facebook page. And also, if you need the presentation or any material, feel free to send us an email or to send us a message through the Facebook, and we will get it to you. So I'm going to start with the presentation and give you a little bit of information about what the new North Carolina Medicaid Ombudsman is and how Medicaid is changing for everyone. So just bear with me a bit while I share my screen. So again, this is the North Carolina Medicaid Ombudsman, and is the advocate for quality care in North Carolina. So on January of this year, the state awarded this program. So people with any difficult or any issues through the Medicaid process, through the Medicaid transformation process, can reach out to the Medicaid Ombudsman to get assistance on any of the process or any of their issues. North Carolina Department of Health and Human Service is moving to North Carolina Medicaid Managed Care. So that means before July 1st of this year, Medicaid was doing it in a more like direct. And now after July 1st, Medicaid will change to managed care. This means that it will focus on health and care management, moving to an integrated care to address both medical and non-medical drivers of health. This means that Medicaid services will be delivered through health plans that provide healthcare services for their members, and each health plan will have a network of providers. The North Carolina Medicaid Ombudsman will advocate for people with Medicaid to get the care that they need and will help them to navigate the new environment by providing free, confidential services. The new North Carolina Medicaid Ombudsman have four main cores of responsibilities. One is to educate, then advocate, refer and connect, and communicate with the North Carolina DHHS and partners. So we will be able to provide a free confidential support and educations about the rights, the responsibilities that people have under the new North Carolina Medicaid. You can contact the North Carolina Medicaid Ombudsman by phone, by email, online, and coming soon, we will have in-person assistance. So everyone that needs assistance can call the 877-201-3750. And also you can visit our webpage, www.ncmedicaidombudsman.org. The services provided by the North Carolina Medicaid Ombudsman is to provide. So we will provide information to Medicaid beneficiaries about the rights under managed care or North Carolina Medicaid Direct. We will offer members guidance on filing appeals, grievance, and with their Medicaid plans. We're also gonna help investigate issues and reported by the members and help them to try to resolve those issues informally. We will monitor the issues that members are reporting to help them to, through their experience, to communicate all these issues with the North Carolina Department of DHHS to address those problems. And we will also work on a referral manner. So refer members to community services to support health-related needs, but also to include legal aid, social services, and other support for a wide variety of issues. So right now, Medicaid, the way that Medicaid works in North Carolina is a government-financed health insurance program that covers some low and moderate income individuals. In North Carolina, there are over 2 million people that are covered for Medicaid. An additional 100,000 children are covered by North Carolina Health Choice. With a few exemptions, Medicaid currents operate through a fee-for-service system in which the state is paying directly the providers. The North Carolina Health Choice is a North Carolina federal child health insurance program, and that provides coverage to some low to moderate income children with families' incomes higher than the Medicaid eligibility income, but are currently below the state-specific limit. So what those changes, the new changes means? So for North Carolina transition to managed care, the changes would include that they will have a network of providers and services that generally must be obtained for providers in a person's health plan and network. Most people with Medicaid will enroll in a standard plan, and those coverage will start on July 1st of 2021. Individuals with significant behavioral health needs or intellectual or development disabilities will have a choice whether to enroll in a health plan until July 2022. So they will have one more year to decide which plan they will prefer. And then for the North Carolina Medicaid managed care is intended to focus on health and care management, moving to an integrated care that will address both medical and non-medical drivers of health. Most Medicaid beneficiaries must choose a health plan in North Carolina Medicaid managed care program. Some people will stay in North Carolina Medicaid Direct and will not need to choose a health plan. Other people will have the options to enroll in a health plan. Also, health plans are responsible for reviewing and evaluating requests for services. What is not changing? So for the new transformation, eligibility rules and the application process to get North Carolina Medicaid and North Carolina Health Choice will remain the same. So it's going to be the same eligibility and the same process for you to get a Medicaid in North Carolina. The covered services, health plans may also offer added services. how services are authorized and or delivery for those not enrolled in a health plan will be the same. The waiver wait list and the clinical coverage policies will keep the same. So who needs to enroll or who needs to choose a health plan? So most of Medicaid's and North Carolina Health Choice beneficiaries have been receiving for the past almost 2 months, they have received a letter on their mail or a notification that they need to choose a plan. So those that have received those plans need to check with the enrollment broker and choose a plan before May 14. Who has the options to choose a health plan? So there are two groups that they have the option. One is the federal recognized tribal members and other eligibility for service through the Indian Health Services. And the second group is the beneficiaries who need extra services for developmental disabilities, behavioral health, traumatic brain injuries, or substance use disorders. Who does not need to enroll in a health plan? So right now, there are some exceptions for different Medicaid recipients that they do not need to enroll or they do not need to do anything before May 14. And those groups are people receiving family planning Medicaid only, people who are medically needy, people participating in a health insurance premium payment, people participating in a program of all-inclusive care for the elderly, people receiving refugee medical assistance, children in foster care, children receiving adoptions assistance, children receiving community alternative programs for children, people receiving community alternative for disabled adults, receiving Medicaid and Medicare, innovation waiver services, and traumatic brain injuries waiver services. So those, the list that I just mentioned are the beneficiaries that currently has Medicaid and they do not need to choose a plan before May 14. So to give you a little bit of more of a timeline, so starting on March 15 of this year, the new Medicaid transformation starts to, they open their enrollment and you need to choose a plan before March 15 to May 14. We are currently during that open enrollment. And everyone that receive a letter saying that they need to choose a plan before May 14, they need to call the enrollment broker that is listed, and the number is listed on that letter. Then, what happens if you don't choose a plan before May 14? So after May 15, the state will choose a plan for you. And that will start coverage on July 1st of 2021. Then the tribal options and managed care will launch on July 1st of this year. Then you will have a 90-day period to change. So for example, if a family is not sure and they didn't choose a plan before May 14, and by May 15, they will get a letter saying that the state out-enrolled them on a plan that they didn't want it, or maybe their primary care physician is not listed as a part of the network, you will have 90-day change period. So you will have until the end of September to change the plan or to make any modifications to that plan. Beneficiaries engagement milestone timeline. So as I mentioned it, the North Carolina Managed Care website went live last November. And then the Medicaid Beneficiary Portal was launched on the same month. Then the North Carolina Providers and Health Plan went live on January of this year. The open enrollment start having their enrollment period on March 15. And everyone should get a letter on the mail starting on March 1st. Our enrollment will start on May 15. And then the tribal options and managed care will launch on July 1st. Right now, Medicaid managed care are divided in North Carolina by 6 regions. Mecklenburg, Cavaros, Union County are in Region 3. So that's the region that Enlace covers. So if you need more information about the North Carolina Medicaid Ombudsman for Region 3, you are more than welcome to contact the North Carolina Medicaid Ombudsman. There are 5 providers that are listed for the new North Carolina Medicaid Managed Care. The AmeriHealth Corridas is a statewide, Healthy Bloom, United Healthcare, WellCare. Those 4 are a statewide plans. And then for Region 3, which is the region that we are, you have an extra one that is the Carolina Complete Health. Then for the Eastern Band of Cherokee Indians tribal options, you have a different provider. As I mentioned it before, you will have 60 days to choose a plan. And then you will have 90 days to that it will begin that you have kind of like a period that you can change your plan. The exempts for beneficiaries can disenroll at any time, and after 90 days, unless they have a special reason, beneficiaries cannot change their plan until the new Medicaid recertification date. And members who do not select a PCP are assigned to one by their health plan. So that's why it's so important for you to choose a plan before May 14 and to choose one plan that includes your primary care physician. Jules?
Hi, everyone. Thank you, Natalie, for that introduction. So what I will be going over now is the existing Medicaid managed care program, as well as some additional roles that the North Carolina Medicaid Ombudsman will play. So next slide, please. So as many of you may or may not know, the current Medicaid managed care here in North Carolina the current Medicaid operates, I apologize, under a fee-for-service model, meaning that the state essentially runs all of the Medicaid. And all of the providers generally deal directly with the state, and that's the program that we have currently been running under. So what will change, as Natalie touched on earlier, is that now individuals that are enrolled in Medicaid, their care will be managed by prepaid health plans. And she went over some of the prepaid health plans that will be available to individuals. So they have to enroll by the 14th, which is right around the corner. And then starting on the 15th, they will be auto-enrolled over the next few days into plans based on a certain algorithm from the state. Individuals, as she stated, will have 90 days to change those plans for any reason. So they'll have until September 30th to do that. So if you do get a notice in the mail that says that you've been enrolled in a certain plan, don't panic. You still have the option to change that plan. So right now, our managed care here in North Carolina is primarily managed by LME MCOs, which are local management entities and managed care organizations. And they have been managing behavioral health services for years. Next slide, please. Oh, wait, that went the wrong way. That you went backwards, I think. Yeah, next one. There we go. So this is a map of the regional LME MCOs. Next slide, please. And this is where we go over what is happening with those LME MCOs. So if you yourself is receiving behavioral health services, or you have a family member that's receiving behavioral health services, it's important to know that if that level of care is where they need it to be and they don't want any changes, they don't need any changes, they do not have to change. I think that's something really important for individuals to know. So now until July 2022, LME MCOs, they'll continue to manage care for those only with significant behavioral health needs or intellectual developmental disabilities. And we'll go into that in a little bit more detail in the next slide. Physical health care for this population continues to be an NC Medicaid Direct, which is what the fee-for-service program is changing to, formerly known as that fee-for-service. And then after July 2022, that's when the tailored plans come out. So that's when individuals with these specific needs who are currently remaining on Medicaid Direct will be able to enroll in plans that will meet all of those significant needs, health needs that the individual has. So that DHHS will announce in the summer of this year, so in the coming months, which of the current LME MCOs have been selected as tailored plans, and then they'll move forward from there. So it'll be a similar process to what we're going through, but it will be for a different population and a different set of plans. The tailored plans, again, will manage both behavioral services and physical care, but only for those with significant behavioral health needs or intellectual developmental disabilities, substance abuse disorders, or anyone with a traumatic brain injury. And there'll be one tailored plan per region, so that will make things relatively straightforward. It'll be similar to the way that it is now. Next slide, please. So if an individual does receive a letter or is concerned that they may have to enroll in a plan, or they're getting notification that they may have to enroll in a plan right now, there are two options to stay in Medicaid Direct based on significant behavioral health needs. These two ways are diagnosis as well as use of service. So if you are currently receiving, or if you, let's say that you don't have any needs as of right now, however, you end up enrolling in a prepaid health plan under the standard plans, and then after that date, you get diagnosed with a specific illness or condition where you do have significant behavioral health needs. In that situation, that would be an instance where you would want to request to go to Medicaid Direct, because that's where those services are going to be tended to versus the standard plans that they currently have. The other option is use of service. So if your use of service isn't that high right now, but then it increases maybe due to a diagnosis or something else, then that would be another option for you to be able to remain in Medicaid Direct or disenroll from a PHP and move to a Medicaid Direct plan until the tailored plans are available for you. Next slide, please. So requesting to stay in Medicaid Direct, I would say that this is the question that we get the most. And so we want to go over that and make sure that individuals understand that very clearly. So most people who have, as we've gone over, most people that have behavioral health, substance abuse, intellectual and developmental disability, or traumatic brain injury support needs will continue to receive their care through their Medicaid services through NC Medicaid Direct. And they will receive their health and pharmacy services from the state and the behavioral health services from the state or a local LME MCO. But most people who receive services from an LME MCO will stay enrolled in Medicaid Direct. So that's kind of everything we've gone over just in one paragraph. So that's kind of a good place to go if you have questions about that. And so if you're receiving care for serious behavioral or intellectual disabilities, you may be able to stay in Medicaid Direct for now, and to request not to enroll in a plan, a form must be completed by you or your provider or a care manager. Anyone can assist you to complete that form. And the forms can be found at ncmedicaidplans.gov. And like I said, if you have a specific provider that you work closely with or a care manager, they can also assist you to complete that form as well. And if your request is denied, you always have a right to appeal. Next slide, please. So also what is changing is who manages transportation. So in the past, it has been just something, you call a phone number and you're able to get the transportation through the Medicaid program. Now that we have these standard plans where you're enrolling in these plans, it is the plans themselves that will actually be managing the transportation. It's also important to note that individuals who are enrolling in standard plans effective July 1st, 2021, that they can actually start to schedule the transportation as early as June 1st, which is right around the corner, for appointments that are scheduled after July 1st, 2021. So that's just something important to keep in mind. Next slide, please. So another thing regarding the transportation, the non-emergency medical transportation, is that plans must provide NEMT appropriate for the member to the nearest enrolled medical provider. They must provide NEMT to a Medicaid covered service provider, including services not covered through NC Medicaid managed care provided by a qualified medical provider, and they must provide travel related expenses. So that includes lodging, food, parking, fees, tolls, transportation vouchers. And they also must develop a network of NEMT providers. So if individuals are trying to call and schedule some transportation and there are issues with that, so it's taking a long time to get that scheduled, or they're calling and they have an appointment and they're not able to schedule the transportation because there is such a long wait or whatever that might be, those would be issues that we would want to address, because we want to be, people that are enrolling in these plans need to be able to get to the appointments once they schedule those. Next slide, please. So something else that we want to go over today is beneficiary protections. So as we're going through this process, it's really important to realize, what your rights are as a beneficiary. So the protections that have been put in place in order for beneficiaries to receive the same level of care and access to the care that they need is that the department approves all of the marketing materials, and plans cannot engage in direct solicitations. Health plans must provide language assistance services, including interpretation and translation. Written and oral member materials must include taglines in the top 15 most common non-English languages in North Carolina. Grievance, appeal, and state fair hearing procedures, including timeliness standards. Appeals are for denials of benefit determinations or denials of payment or of disenrollment. Grievances include all other complaints against the health plan or providers, and health plans must have member advisory committees, and health plans must operate member services lines, behavioral health crisis lines, and a nurse line. So those are just a few of the protections that have been put in place and requirements of the plans as they're providing service to North Carolina's Medicaid population. Next slide, please. So as Natalie went over earlier, a role of the North Carolina Medicaid Ombudsman is providing information and education. So we know that it's really confusing right now. There's a lot going on with Medicaid transformation, and individuals may not know where to go for answers or just to ask basic questions. So the North Carolina Medicaid Ombudsman is here and available to provide information and education to the community. So our primary responsibilities are to educate, inform, and assist Medicaid beneficiaries with questions about the transformation to Medicaid managed care, how to navigate that system, and also your rights and responsibilities under managed care. But we offer more. It does not end there. Next slide. So I think something really important about the North Carolina Medicaid Ombudsman is there is no wrong door approach. So anytime anybody contacts us, we will be able to either provide information. If we are not able to provide that information, we will refer or connect that individual with an entity that can assist them. So, we're not telling everybody and their dog to contact us. However, when it does come to issues and you're just not really sure where to turn or even where to start, the North Carolina Medicaid Ombudsman can be a good place to start. I will say that usually we do encourage you to, if you have attempted to contact the enrollment broker or a PHP and you have not had success with whatever your inquiry is or your complaint or your appeal or whatever that might be, or your issue, and once you have exhausted those avenues, contacting us and we can assist you with those next steps. But again, we will provide general information and refer you where you need to go if whenever you contact us, we are not the place where you need to be. So don't hesitate to contact us. We are here to answer all questions that we possibly can and connect you with those resources. Next slide, please. So regarding referrals, that's one of our primary roles. So we want to be able to assist you, even if we can't actually assist you with that issue, we want to refer you to an entity or agency that can. So we plan to do that. We plan on utilizing NC Care 360, our existing partnerships that we've been developing for 30 plus years. And then also, 211 and all of those resources that exist out there. Next slide, please. So legal referrals. So the North Carolina Medicaid Ombudsman has statewide partner agencies that will accept referrals for ombudsman for members who need or request legal advice or representation to assist with appeals and other issues. So that's important to know that if an individual contacts us and we are not able to assist them, however, it is maybe a Medicaid or a related issue, we can refer them directly to a legal aid agency for assistance. So again, if someone contacts us and it's not necessarily an ombudsman issue that we can answer, we will refer and get that information out to that individual, get them connected where they need to go. So that's one of our main goals. Next slide, please. So something else that we do whenever someone contacts us with an issue that we do take on, we will advocate and we'll seek the best and most efficient outcome for them. So we'll regularly communicate with beneficiaries concerning these efforts. So we plan to investigate, follow up, and do that resolution if that is within the scope of what the ombudsman does. Next slide, please. It's important to note that while we will refer legal issues to legal aid entities, the North Carolina Medicaid Ombudsman itself will not be providing any sort of legal advice or doing any sort of legal work around the calls that we get. So that's really important to know. But if someone does contact us with a legal issue, then we can refer them to a legal aid agency if that is appropriate. So just keep that in mind whenever you're talking to individuals that you're assisting, or if you need to contact the Medicaid Ombudsman for assistance, we are available, but we do not actually do legal work. Next slide, please. So just quickly want to go over the key takeaways from today's presentation. It's important for everybody to choose a plan and a PCP if they are in the mandatory group. And that needs to be done by the 14th of May, which is right around the corner. Is that Friday? I think it's Friday. Yep, it's Friday. So get cracking. Go ahead and call that enrollment broker to get enrolled. And then just another reminder is that auto enrollment does start on May 15th and will go on for a couple of days. Once individuals are auto enrolled, they will receive a welcome packet in the mail, so they will know what plan they're enrolled in and what PCP they may be assigned to. If they're not satisfied with the plan that they're enrolled in, or it's not the PCP that they wanted, they can contact the enrollment broker. They can find out if their primary care provider, if they have contracted with any of the other PHPs, and then enroll in that plan instead. If you do have questions about that, I suggest contacting your provider first to find out what plans they have enrolled in, and then contacting the enrollment broker if a change is necessary. If you're satisfied with auto enrollment and the plan that you've been enrolled in, there's no need to do anything. Excuse me, there's no need to do anything. So just keep all of that in mind. Eligibility for Medicaid is not changing. That's another common question that we get. And as Natalie went over, that is not changing. Eligibility in North Carolina is remaining the same. Medicaid continues to cover the same services. So that's also something to keep in mind. So even though a prepaid health plan is now managing your care, it's the same services that you've always received. The health plan decides whether to approve services that a doctor requests. So that's another thing to keep in mind. Generally, members must see providers in their health plans network. There are exceptions to that, but there is a process that an individual must go through in order to get that approved. And there are no enhanced behavioral health or intellectual developmental disability or substance abuse services in the standard plan. So that's why it's important for those individuals to remain in Medicaid Direct until the tailored plans are available. Next slide, please. So contacting the North Carolina Medicaid Ombudsman, as Natalie stated, you can call us. Our phone number is 877-201-3750, or you can visit us online at ncmedicaidombudsman.org. We would love to hear from you. And we would love for you to check out our website. We have outreach materials that are available in Spanish and in English there. The website is available in Spanish. And we have additional resources and previous webinars that we've given on the website. So feel free to go to the website and check us out. Next slide, please. So just something that we want to go over, especially with our Enlace partners, is that digital versions of the outreach materials are available on our website, but also if individuals are interested in presentations directly to their organization or to their staff, or they know a group of individuals who could really benefit from some information from the Ombudsman or about Medicaid transformation in general, Medicaid managed care, that we are available to do that. And there is a form that is available that we can have Enlace members send out to you. So just keep that in mind. We're trying to get the word out as much as we can. We know people have a lot of questions, so we want to make sure that we're available and that people have our information far and wide. And then the last slide, please. Please feel free to connect with us on social media. There will be information, helpful information will always be available on these channels. You can always direct message us there. Or you can go to our website and reach out to us. So thank you all so much for your time today. And I will pass it back over to my colleague, Natalie. Thanks for your time.
Thank you, Jules. Y para toda la gente que habla español, esta es la oportunidad para yo darles una breve resumen de lo que acabamos de ver. Déjame detenerme aquí un momentito y no seguir compartiendo la página para poderles hablar. So, desafortunadamente esta presentación todavía no está en español, pero quería tomar la oportunidad que nos da Enlace y hablarles a todos ustedes acerca de los nuevos cambios que hay para el Medicaid. Muchas de nuestras familias hispanas reciben en este momento Medicaid o sus hijos están inscritos en lo que le llaman Health Choice o Medicaid para los niños, y a partir del 14 de mayo tienen que escoger un nuevo plan. Muchas de las familias que nosotros atendemos han estado recibiendo unas cartas desde el marzo 1 de este año diciéndoles acerca de estos cambios y acerca de lo que usted tiene que hacer. Antes del 14 de mayo tiene que llamar a la compañía que se está encargando de las inscripciones. En cada una de las notificaciones que usted recibió por correo está el número de teléfono de ellos. Es muy importante que usted no deje pasar la fecha de mayo 14, porque a partir del 15 el Estado va a decidir en qué plan inscribirlo a usted o a sus hijos. Es por eso que es tan importante que usted se inscriba antes del viernes. También quiero aprovechar la oportunidad para dejarles saber que hay algunas excepciones para que usted no tenga que cambiarse, y lo mismo es en el sentido de que usted va a tener 90 días después del 1 de julio, si usted no está contento con el plan, de poder cambiarse o escoger uno diferente. Es supremamente importante que usted no deje pasar estas fechas, pues después del 30 de septiembre, usted no va a poder cambiarse de plan hasta la nueva recertificación que tenga con Medicaid. Por eso le estamos haciendo esas presentaciones. Muy pronto vamos a tener esta presentación que acabamos de tener para Enlace en español. Si usted está interesado en tener esta presentación para un grupo de pronto de su iglesia o un grupo local o un grupo de mamás, les invito a que me manden un mensaje, ya sea por enlace o directamente en el Centro de Apoyo Legal en Charlotte, que con mucho gusto podemos hacer esa presentación completamente en español. Por ahora puede visitar nuestra página en NC Medicaid Ombudsman.org. La página está completamente en español y tiene también muchos materiales de educación, tiene también grabaciones y tienen mucha otra información. El Medicaid Ombudsman es el nuevo programa que va a estar defendiendo los derechos de todas las personas que reciben Medicaid en Carolina del Norte. So, si usted tiene en algún momento algún inconveniente o algún problema con el periodo de inscripción o contactando a la compañía que está haciendo las inscripciones o contactando a un proveedor, siéntase libre de contactar el North Carolina Medicaid Ombudsman. Hay gente que lo va a atender completamente en español y de una manera muy confidencial y segura. Gracias una vez más por estar el día de hoy en esta presentación especial de Enlace. I want to thank you everyone that took the moment to watch this presentation. And if you have any questions, please feel free to send us a message or put something on the comments, or feel free to contact direct class. Thank you so much and have a great day. Alicia?
Yes, thank you everyone for tuning in. Natalie, will you be accepting any questions now? Okay, I just have a couple for you. So what are some of the factors or the circumstances in my life right now which might affect which plan I choose to go with? Like what are some of the questions I should be asking myself and should be researching about the plans, just like broad topics?
Okay, Jules, do you want to answer that or do you want to?
Yeah, I'm happy to answer that. So it's important to know that Medicaid services that are being provided are remaining the same. So the level of services that are being provided by each of the PHPs is the same. That is not changing. I will say that each of the PHPs, they do differ in the sense of the incentives and the types of different it's additional services that they're offering. So some of them may offer incentives to join a Weight Watchers program or have a discounted gym membership and things like that. And the best way to find out about that is going to the ncmedicaidplans.gov, and they have a plan comparison tool on there, and it's really helpful, and it's a good way to know as far as the additional services that will be offered and sort of look at those plans side by side.
Awesome, thank you. That was helpful. And then is the Ombudsman an unbiased party in terms of health plans and referrals? Is it funded by the state, or is there like a financial incentive for the referrals that you do?
No, so that's a great question. So we are an unbiased, objective party. We are funded by the state. We are not funded by any of the PHPs. And the contract was actually awarded to 3 legal aid agencies in January: Legal Aid of North Carolina, Charlotte Center for Legal Advocacy, and Pisgah Legal Services. And the reason it was awarded to our agencies is because of the years of experience we have with Medicaid beneficiaries, and we have a statewide presence. So we will continue to offer the same level of service that we have always offered, just in the capacity as the North Carolina Medicaid Ombudsman and in this new role with this transition to managed care.
Awesome, thank you. And so when I'm ready to call or go online to enroll in a health plan, what should I expect to happen? Is there any documents I should get in front of me prepared, or any particular time of day I should make sure I try to connect?
So the North Carolina the North Carolina enrollment broker, they are the best place to start. So they have staff that is ready to answer your questions and help you compare the plans, because they will do comparisons. So if you call and you're like, listen, I'm not really sure what I need, what my needs are, what I want, can you help me go through this process? They're there to offer that information and to help you through that process of selecting a plan. As far as I know, there's no documentation that would be required. When you're providing your information, they're able to look you up in the North Carolina system so they can see what type of Medicaid you have and whether or not you're mandatory to enroll. And then if you are, take those next steps to help you through that enrollment process.
Okay.
I just want to add to that, that it will be, it's not that you have to, but it comes handy to have your Medicaid subscriber number. So they will find you, because, for example, for Latinos or Hispanic families, that a lot of people are Maria Sanchez or Maria Lopez. So it will be easier for them to look you up with your Medicaid subscriber number. I just want to add that, but it's not that if you don't have that number, you cannot enroll. It's not that, but it will become like handy to have it.
And if you want to get, that's a great point, Natalie. And if you do want to get your Medicaid ID and you aren't sure what that is, you can contact your local DSS office or your caseworker, and they can provide that information to you before you call the enrollment broker. And I also did want to note that the enrollment broker, as well as the ombudsman, it offers services technically it's available in over 200 various languages. So if someone contacts us and they need assistance in a language that maybe we don't have a translator for, we can get access to that with through a language line interpretation service.
And the number is also located on the notice that you got on the mail.
Awesome.
Yes.
Okay. And then I just have a couple of more quick questions. So if I'm in that 90-day period where I can switch between them, and I determine that I do want to switch, I'm already signed up, but I want to switch to a different health plan, what is that process like? Do I go contact that health plan and say I want to unenroll, or do I just go to the enrollment broker and tell them?
That's a great question. So you would contact the enrollment broker directly and let them know that you want to change plans and the plan that you want to switch to, and then they would help you through that process. You wouldn't have to contact the plan directly.
Okay. And then I work with people with developmental disabilities. So is there any material or education anywhere you can direct them that is like educational material that is for people with developmental disabilities? Maybe they're their own guardian and they're trying to decide what to do. Any kind of guidance or resources on that?
Yeah, so there's really helpful material on the DHHS Medicaid Transformation webpage. Has a lot of great resources for individuals, beneficiaries, but also for individuals that maybe are waiting for the tailored plans. So there are good resources there. You can also go to the Ombudsman website, NC Medicaid Ombudsman.org, and there's helpful information under the FAQs that are there. And then also you can go to ncmedicaidplans.gov, and there's some helpful information there. But I would say that a good place to start, just because of the breadth of the information that is on there, I would say a good place to start is the DHHS Medicaid Transformation webpage.
Perfect. Awesome. That's all the questions I have. Like Natalie said, if you think of any more on Facebook, you can put them in the comments. And we'll get back with you with a response. But thank you so much for the information today. That was a lot of information. It was really helpful. So thank you for doing this for Enlace.
Thank you,
Great.
Alicia.
Thanks for.
Yeah. All right. I think we're ready to wrap up. Thank y'all so much for being here. I hope y'all have a good rest of your day and rest of your week, and take care and stay safe. We can't wait to see you in person again.
Bye, everyone.